All right, guys, welcome to season 1, episode 1 of the Sleep Well Journey. I am Dr. Callie Hale.
And I'm Dr. Kyle Hale.
And we are so excited to be talking to you today about who the Airway dentists are.
That's what this episode's about. It's our first episode. We're going to just talk about who is the Airway dentist, what is the Airway dentist,
how we got here today to be talking about this.
Where did it start?
Yep.
Yeah. And so we've talked about this a little bit before already, but I think the best place to start is right now we have several locations, but the one that you practice out of primarily is called New Teeth Dental Solutions in Lake City.
Yes.
And
my baby.
3 years ago, it took a right-hand turn kind of out of nowhere, and it was growing, doing awesome, still growing, doing awesome. But then you came to me and your dad, who's also a dentist and our mentor. And you're like, I want to go do the sleep thing. You're already doing a lot of ortho with clear liners. You're already doing some jaw reposition devices for sleep, probably more than most general dentists were doing at the time, because you saw the need in it. And then you're like, hey, I want to go spend a lot of time, a lot of money, a lot of my energy learning this new thing.
Yes, expansive techniques.
And that all came kind of came on the heels of another big change in the practice. So why don't you just, like, before we talk about who is the Airway dentist now?
Yeah.
This is like the origin story.
How did I get where I am today, to having a podcast and hoping like 2 people listen to it?
Yeah. I don't care who listens to it. This is for us.
This is for us.
This is marriage counseling.
This is therapy. This is literally therapy. Well, okay. Well, thank you. That's really sweet. So this office has been my baby, and I've put my heart and soul and blood, sweat, and tears in it to get it where it is. And with the help of you, and I feel like you are such a secret weapon behind me all of the time with our business and our systems and making sure that everybody still shows up for me every day. But the sleep apnea treatments that we can treat, the side effects of sleep disorder breathing really just became my passion. Like, really much, I wanted to learn how to correct the problem if we can by getting to the root cause. But before that, it was this entire mindset shift in my approach to health, like my approach to the materials we were using. Yeah, not just teeth, systemic health. I mean, the sleep apnea and the sleep disorder breathing conversation is like intricately linked with that. So they really go hand in hand. But before that, it was like, what materials are we using for our fillings? And how are we protecting ourselves when we take certain materials out? And what about the whole fluoride discussion? I was having patients come in and say, I'd really prefer not. And is that like some hill I'm going to die on? Like, am I going to sacrifice that patient relationship because of fluoride? Like, it has so much more to do with our gut health and how much sugar we're eating and whether or not we're mouth breathing.
And there are plenty of dentists out there willing to die on that hill in front of the patient who's been a patient for a long time and now just has a question about fluoride in their, whether it's topical fluoride or the prophy paste or anything that they're using. And the old gray hair dentist walks in and will prosthetize them. Oh, totally. In the treatment room.
Try to teach them something. Yeah. Absolutely terrible. Yeah. We have to be more open to our patients. And I say this a lot when I mentor other dentists that are talking, in this space and they're wanting to know more about biologic dentistry and just like, how can they do the best for their patients? And it's just that we have to make sure that when your patient's coming to you with like, hey, I want to know about this like coconut oil pulling thing. And they kind of like roll their eyes and they want to know. And the only person that's going to look dumb in the room at that point is the dentist. If we don't know about it, if we don't know the safe quantities and how to use it and what they can use. And for me, I was learning things from my patients. I had patients come in that had spent a large majority of their life studying nutrition and materials. And I was, wow, where did you come from? I mean, this is amazing. And I would say, give me whatever you've got. Like, I want to learn that. And that was an immediate bond that I had with those patients. And I just think we need to be way more open to that, because if we don't know some of the things that they're learning and researching and coming to us with, and then we just berate them for it, or we label them as a patient, like, oh yeah, that so-and-so's coming in, they're not going to want, fluoride. Everybody get prepared for that fight. Like, oh my gosh,
Well, and let me interrupt you because the fluoride hill is really common. And if you're a dentist, you know what I'm talking about. If you're a patient who's ever tried to talk to your dentist about alternatives to fluoride, you probably know exactly what I'm talking about. But on the flip side, the reverse of that coin is change. And on the other side of that change coin is plenty of dentists going to CE every year, multiple times a year, to learn new techniques just in dentistry, new techniques just within like fillings, like the types of resins and composites and bonding agents. Yeah. And they're willing to try anything. But because I don't know if it's because it's the health perspective or the whole, or maybe it's just an overwhelming category altogether for them to think about the body being connected to the mouth. Because they kind of identify themselves as molar mechanics. That's kind of like the term we use. And
like it's not connected to everything down here.
I can fix this one tooth any way I want, but there's no way that, I almost started talking about amalgam. We should probably not do that in this episode.
Different episode. That's a different episode.
But I think the change and your response to change and what you expected the office to do when patients had these concerns with change, and you just said, I don't care. And we have patients that do want fluoride. We have patients that are adamant about no fluoride. Yeah. And then we have patients that are mostly agnostic, like they don't know what we're going to use. And we're a family of dentists, and we know that if you want to stop cavities, it has nothing to do with the sticky crap we put on your teeth the one day a year, or maybe even if we're lucky twice a year.
Yeah. I had a patient one time that came in and wanted, it was like no big deal, but I was like, okay, we've got the varnish. I'm happy to do that for you, whatever. And he goes, well, I'm going straight to Dairy Queen after this. So put that stuff on there. And I'm like, really don't think it's going to help you from your Dairy Queen, addiction. But anyways, that's where the practice was going. And that kind of conversation and in relationships that I was building with the patients, the whole office took part of it because that was a top down. Like I think that's a really important thing for dentists that are listening to, like, if you're in your back office or your morning huddle and meeting and you're talking about how like we are going to meet some sort of goal of varnish this year, or whatever, like that's going to portray out from your patient, your staff. So then if they're talking to the patient and really pushing it, like there just has to be a different relationship.
That sounds like the worst dental grind on earth.
Yeah.
Is if the only way you can grow your dental practice is by pushing a $20 service and hygiene. So because from the business side, this is something that gets talked about all the time, is like how can I increase the amount of revenue per hour in hygiene, right? On dental, it can on the doctor side, it can fluctuate a lot. Are you doing, a couple fillings? Are you doing a couple crowns? Are you doing a couple implants? And for patients listening to this, anyone who's paid for dental work has that's a big difference in cost.
Totally. Yeah.
But and getting your teeth cleaned and getting x-rays is pretty much the same all the time.
Right.
And so they say, well, I need to make more money, or I want the practice to grow more. And so I'm going to do fluoride. And that's the thing. Yeah. And I think they're totally missing the boat, because that's got to be the most boring thing.
Yeah, they are. And they're just like, I think what it really makes us unique across the board with all of our practices is that we don't have quotas like that at all. We are literally focused on our leadership teams, keeping our dentists, keeping our staff, and the patient experience. I mean, we just opened the Sugarland Airway dentist location, and during our growth meeting yesterday, that was part of what I was talking about. Like, guys, we are here to love. We are here to provide for our patients. And I want them to walk in the door and feel that connection. And we get a lot of incredible reviews and accolades from our patients about how competent our staff is. Because, that's something I think dentists need to focus on way more than whatever new procedure code they want to be billing out. Because nothing sucks worse than walking to a doctor's office. Nobody looks up for their computer. They don't talk to you. They're like, sign there. They don't care. They're, and when that happens, you have to know that that's coming from top down. But we got on a big tangent. with this whole thing.
No, I don't think we're on a big tangent. I think we're like sidebar.
Yeah, sidebar.
We're talking about
how I got where we are
related to the subject.
Definitely.
But I think the only thing I'll add to that is that came from your dad.
Yeah,
from 40 years of experience of practice ownership.
Yeah.
And that we have no one here's performance in our across our 7 locations and our 60s plus employees. No one here comes to work thinking that their performance is measured by a dollar amount.
Right.
Ready to practice.
Yeah, which is super
we measure
special.
it by Google reviews. We measure it by patient
happy
satisfaction.
Patients. Yeah.
I mean, all these things that are really touchy-feely, but that makes us feel really good. And
So for those of you listening that don't know, I came from a family of dentists. My mom and dad are both dentists. They met in dental school, and they are the reason that I am where I am today, and that yes. And we wouldn't have these practices without them. We wouldn't, I can't even imagine. I remember getting out of dental school and thinking, man, this is great. I literally have somebody that can get me out of anything. And you know, when you get out of dental school, you think you know everything. Like, I mean, you do. You're like, you worked so hard to get in, you survived. You weren't one of the people that failed out and got kicked out. And then you get out and you're like, you know just enough not to be a danger to the society. You know, like, I know it sounds terrible, but
you're still a slight danger.
Just a little bit. But I mean, he was just like, no, you're going to do, this is something my dad told me. And I think if you're a new dentist listening to this, it's so important. You need to do every single thing for 5 years. And when it finally got to 5 years for me, I've been out now, this year's 8 or 9. When it got to that point, I told my dad, I was like, I'm not pulling teeth anymore. I'm not pulling teeth anymore. He's like, no, you got to do it. I was like, it's been 5 years. I'm not extracting teeth anymore. And it's not because I can't. I completely can. But it's because I don't want to. I don't like it. There's so many things that I can do better, you know, that besides that. And so it's just a funny, like, full circle thing. But, you know, the practice as it was exploding, I would say exploding truly, with the care that we were giving these patients, where it was a safe place for them to come, really is what changed it. But then when I started getting into sleep dentistry, it took us to places I didn't know possible. I never thought I'd have a podcast. I literally never thought I'd be sitting here right now having a podcast talking about what I do. I never thought that I would spend literally the last 4 years hundreds of hours of CE. Like, I just didn't. And I mean, I got out of school and I never wanted to take another test again. Yeah. Like, you know, and then I took and passed a diplomate exam last year, and I've got another one coming up this year, and it's just like, it never ends. And how many times do I tell you, I don't even know. I don't know. What if I do, you know? And sometimes they say that's how you know a lot, is when you get to the point that you're like, I need to know more, you know, I don't know. But we're really excited about this podcast, and I think we should talk about who we are.
Okay, that's chapter 1 of this episode.
Yes.
We talked about, like, this change, and that change was just, okay, we're open-minded, we're loving on our patients, we're saying that, yeah, I mean, we'll have these conversations. I'll do my best to learn about oil pulling. I'll learn my best to do my best to learn about maybe like hydroxyapatite toothpaste and all these alternatives, because at the end of the day, those things are small things. Yep. The big things are what's your quality of life? How long are you going to live? What's your risk for heart attack and
oh my gosh,
stroke?
Yeah,
and so,
absolutely.
And I remember, like, the first article you shared was actually written by, it kind of in this, like, it stood out, and it wasn't sleep apnea related, but it was like that systemic link. It was an implant article about recurrent lesions on, recurrent infections on endodontically treated teeth, and how they weren't getting discovered. And then that was like, whoa, there is a lot of science behind this. And so that's really what kind of, I know for me, because I was not in that world, that's really what kind of opened my eyes to it, is like, okay, so there's legitimacy behind this in a huge way.
Oh, totally. And that was just completely not talked about when we were in dental school. I mean, if you think about it, we have not been out that long. I started in 2010. We're not talking about 50 years of practice here. Right. And for that to never come up, to be told we should just watch those periapical lesions, just look at them and see if they get smaller each year. I mean, that's a cop-out in my opinion. So that was a big those were conversations you and I were having that I think were these loving husband-wife sort of conversations when I'm like, hey, I don't think this is actually good. Yeah, I don't think this is good. I don't think we should be telling our patients that they should leave infection in their jaw. Like, I just don't, you know, and you're like, oh, whatever. You know, it was a lot. It was a lot for us to take in, because you're unlearning a lot of things that you spent a ton of money to learn.
Yeah. So now we're here and in New Teeth League City.
Yes.
Your practice, your baby. Let's see. I guess the next one was you started doing Airway only. Yeah. You stopped doing fillings. You stopped doing crowns. You stopped pulling teeth a long time ago, but you stopped doing pretty much everything else, and not because you didn't want to.
Right. Oh no, just the need was so incredibly vast. So I mean, dentists will ask me that. Well, how are you doing like over 200 cases a year in anything, like, you know, in one thing? And for me, it was the education. So me educating my patients, the community, every single month for the last 2.5, almost 3 years, we've hosted patient education dinners, and that was something I think that could be utilized in any fashion of dentistry. Like, if you're really passionate about implantology, you know, endodontics, prosthodontics, whatever, you get your patients out of this sterile smelling dental environment and you have a nice dinner and just talk about what you love. And for me, in the beginning, I was happy 4 people came. And for any of you listening that were one of those original 4 people, like I'm really, really happy that you came to listen to me. But we're in much larger venues now. We have 30 to 60 people. I've had superintendents at school districts come. We've had physicians attend, PAs, moms, teachers. I think for me, my target audience is the education community, the teachers, because they're the ones that are having these kids not be able to either stay awake in class or not be able to function all day in class. They're disruptive. It's heartbreaking for me when I see a little kid that suffered for as long as they've suffered and they've been kicked out of multiple schools. And that's an episode for another, later on in the season. But it's just one of those things where when we talk about the sleep link in our kids, they're just like mind blown. They're like, where has this information been? And the thing is this information's not new. Mm-hmm. It's not new. I mean, we have a century of data talking about maxillary expansion and all of that. But anyway, I'm just so excited. And when I don't know, it was about a year ago.
And you just left like everyone listening hanging on like.
Good. I hope so.
Because that's definitely coming. We're going to talk about a ton of stuff. And a lot of it is going to circle around sleep apnea, where it started, kind of what's common versus what's normal and how we become accepted. Yeah. But, just to back up a little bit, we're talking about like, okay, we got this booming practice. We also had another booming practice that we still have down in Texas City with Dr. Matt Hicks.
Yeah.
And he just kind of showed up and was like, hey, I want to work really hard. And I said, great, let's go work really hard. And then I said, I want to do ortho. Amazing. Oh my gosh. They're such a blessing to us and everyone around them. But I think it was a year and a half ago, Matt and I sat down
that's what I was going to ask you. Yeah.
And he wanted to open up an ortho only practice. I thought, let's do it.
Yeah.
And
then you told me.
And then I told you.
And what did I say?
And you said, what are you doing, you morons? We got to be doing Airway.
Oh,
sorry.
I don't think I've ever called you a moron, not in public anyway. Yeah. I said, guys, like, yes, but this needs to be an Airway practice. Yeah. I mean, even just coming down to like why we named it what we named it. Mm-hmm. Like even that was an interesting couple of weeks of.
Yeah, that was my idea.
What? Guys, lightning's going to strike in here. I mean, when you're naming a practice, you're trying to, just. It's
so tough.
It's really, really tough. But I was just kind of very, very like stuck on this Airway dentist. I was like, why do we? Yeah, like we were gonna. I don't remember the other options that we were gonna name it, but they were very obviously just dental offices. And I'm like, okay, so do you want to work an uphill battle to let the community know that we're doing Airway? Like that's our focus is orthodontics and Airway. Or should we name it that? And then if they ask if we do cleanings, we're like, absolutely, we do cleanings.
Look, in my defense, I on the business side, I want to make sure we're successful. This is a lot of risk. We're spending a lot of
huge risk,
not just money, but a ton of time.
Yeah.
And I think about like what this time's robbing us from doing other things, from going on vacations, from spending more time with our kids, all sacrifices.
Work-life balance, that's not even a thing. Yeah. Don't get me started on that.
And that's the balance board's broken, but we're still having fun. Mm-hmm. But But then I think you finally wore me down, and my thought one day was, you know what, let's just take our shot, because I think if we stand a chance, especially with your like incomplete or totally complete expertise in this, like there's nothing I don't think you can't do with Airway, and I think I said let's take our shot, and. Of course, you were on board, so that's what we called it. Of course, I was. It was my Airway idea. Dentist. We didn't want any confusion for anyone that showed up.
Yeah,
and I love it. And so it's been named that for many, many months. And then we finally got to open our first one last week, which is in Sugar Land, Texas.
And we've had nonstop patients since we opened the doors. Yeah. I mean, before we opened the doors, there were patients that were calling us. And I mean, I was like, oh, we did it. It's literally, we have this pediatric sort of focus with it in orthodontics, but there's a huge adult component to it with expansion and aligners and what we're able to do thanks to Matt's techniques and ortho. But it was like, I think I expected more kids, and it's just the entire family, which shouldn't surprise me because that's literally how it is here in League City. And you picked a stellar location. I think talking about you a lot more in this series is going to be really fun for the people that are trying to expand their locations and offices. And sometimes people will be like, hey, how'd you get to 7? I'm like, you're asking the wrong person. You need to talk to my husband and my dad and everybody on our team. But anyways, I just think this is going to be awesome. And I think as we were, getting back to how did I start to doing this and how did we transition League City, I had an incredible education that I'm I think we should talk about on one of the episodes, because people always ask me, where should I get educated and what should I do? Right, but there was two really quintessential turning points in my career. And one was listening to a little weekend seminar on adult expansion. And the funny thing about it is,
and when you say expansion, you're talking about making the jaws wider.
Yes.
And maybe more.
Roof of the mouth is the floor of the nose.
Right.
And we are all massively underdeveloped as a species now. I mean, literally, we have generations of underdeveloped arches that have passed down to our kids. Yeah, especially in the United States. Yeah, the Western diet and all that. But I was looking into where to get educated, and I came across Vivos. And at first, I was very against the idea because I was a know-it-all dentist. I knew everything. I got out of school. You can't expand a palate. Oh my gosh, you cannot expand a palate in an adult, right? Ooh, we're about to ruffle some feathers right now. And there was somebody doing it that I knew of, and I'd already had preconceived notions about my opinions on that one provider, so I judged the appliance accordingly. And I tell doctors this all the time. I mean, I was as skeptical as you could get. I wanted nothing to do with it, which is literally comical, right? Because of where I am today, and it's all I do. But I was sitting in the back office of this office talking to Dr. J. Elliott, my dad, about it. And I said, can you believe this nonsense? I mean, they're talking about palate expanders in an adult. And that conversation probably happened. And I don't even know if my dad remembers this conversation. We'll have to ask him. But that conversation went on for weeks. And he finally looked at me and he said, Callie, if this is where dentistry is going, you better go figure it out. Did I ever tell you that?
Oh yeah.
Yeah.
Plenty of times.
So when he said that, it totally put me on my place. And you think about it as a doctor, I don't know if I could say that to a friend of mine and have them give 2 cents about it, right? Like it's going to come with it, but it was my dad. It was somebody who'd practiced dentistry a traditional way in an exceptional way for 40 plus years. And he's telling me, like, don't be closed-minded. Don't assume you know anything about anything. If this is something that we can do, and this can help people improve at a root level, then why are you sitting here acting like you know anything about it? And that's what kills me about these Facebook groups and dentists that are talking about the appliances, because they've never done it. If you've never done it and you haven't read the science on it and you haven't actually taken the training by those of us that are doing it, why are you opening your mouth?
Ooh, shots fired.
Why?
And I saw you point the finger.
No, it's just a hand.
No, that was finger. I saw the finger was out.
So anyways, I go get trained in this. And the other turning point was listening to Dr. Ben Moralia for the first time in my life. Mm-hmm. I flew to the Vivos Institute to have my training done. I mean, there was multiple sessions. Our youngest son was like 8 weeks old. We were taking the nanny. I was like, dude, I'm doing this. Like I was breastfeeding. Like it was a thing. And I was like, well, I don't know what you're going to do with the other 2 kids. I'm taking the nanny. We're going to Colorado because I got this weekend. And they had Dr. Moralia teaching the pediatric expansion part. And the funniest thing ever is I had zero intention of treating kids. I did not pay the money that I paid to be educated through Vivos for the pediatric component, which is literally like so funny because it's like my biggest passion. It's like the entire premise behind what I do, why now, how we can prevent. It's 2/3 of it at least. Yeah. I mean, and it's the Airway dentist locations that are opening. And I sat down and I listened to Dr. Moralia showcases before and after of pure expansion, no IPR, no attachments. And even before the ortho component, using these guidance appliances, these myofunctional style appliances with built-in lip bumpers and tongue tabs and stuff to reposition to correct the nasal, removable to correct the nasal breathing. He's like, you get these kids breathing through their nose, you get them swallowing properly without tethered tissues. Watch what's going to happen in the arches. Mm-hmm. And I was sitting in the front row, just like I was in dental school all the time. I was sitting in the front row going, oh my gosh, this guy who has been doing it longer than I've been practicing. And I've never heard of this ever. Not once in my pediatric rotations in dental school was this ever talked about. And it's the only thing that should be, in my opinion, at least in a comprehensive exam form. Right. And I was like, I have to do this. We have to save the kids. We literally have to save the kids. And, when I lecture now, I've got a picture of Dr. Moralia and I, when we were speaking at the Breathing and Wellness Conference in Las Vegas a couple years ago. And it was such an aha moment for me. Like this doctor who is a dear friend of mine and a mentor to me in every way. And we're both speaking on this now, coming full circle. And his organization is teaching expansion in pediatrics. And so Airway Health Solutions is where I went and got my expanders training if I wanted something that was fixed versus what I had learned at Vivos. And I've been speaking for Vivos now for years. I fly up there. I dedicate a lot of time and heart and soul. I'm so appreciative of them. I am. Like them seeing something in me to say, hey, will you get up and talk about what you're doing? Because I don't do anything halfway. You know that about me. I'm a bull in a china shop. That's what my parents have always said. And if I'm going to do something, I'm going to do it with all of me.
So on the outside, Ben is a huge advocate for you. And I think this is a testament to just like this whole community in general, because y'all's mindset is so different. We talked at the beginning of the episode about you just changing the way you talk to your patients and treat your patients, because it's not I know better. And Ben, you see that in Ben, because very often, like, let's talk about implant education. You go learn something at an implant course, and then you try to teach it maybe 2 years later after you've got a ton of practice in your belt. And the guy you learned it from is going to typically be sour or bitter about it. Like, well, now you're teaching it too, and you're taking money out of my pocket.
Yeah, I don't know.
And he's not like that
Definitely
at all.
Not.
He knows that you teach it for Vivos. He knows that you teach our associates, and he is super proud of you. And that just goes to show, like, his mindset is that of really, like, save the kids.
Yeah.
Like, there's so many kids.
I can't handle. That's why we're opening more locations. I mean, I can't. My girls tell me I'm booked out like 2-3 months and here, and kids can't wait that long. You know, so I'm doing my best. I mean, I'm extremely appreciative for the patients that our patients have for me when they need to come in, and my Airway assistants are literally my right hand. Our entire team is. I would not be able to do what I do without our team here that we've built. And the patients are forever grateful. And I'm really excited about talking about all this. We have so much to talk about. I mean, each episode we're going to dive into different topics and how I treat it and what my philosophy is. And I just want to help other dentists do this. Nobody is our competition. We have to stop thinking about the dentist next door to you being your competition.
There's so many kids.
That's such a small-minded.
This is like someone saying that if you throw sand in the ocean, you're gonna fill the ocean. You're not gonna do it. You know, there's so much to do.
And we need to prevent a lifetime of sleep disorder breathing.
Yes.
We have to start doing it right.
Yes.
Right now.
Yes. So I think this is probably pretty good spot to start to wrap up. But you know, whether you're a dentist listening or a patient, or whether you're an associate in your practice or you own your practice, you know, we're doing this podcast because we really love this deeply. We love this. And so if you've got any questions you want us to answer, we're happy to mix those in. And, but we've got an awesome schedule for this first and second season of the Sleep Well Journey podcast.
Excited.
And we're doing this because we want everyone to know. And there's no one better to tell you what it's like on the front line than the fantastic woman sitting across from me, Dr. Callie Hale, my wife.
Thank you, honey.
And we want, you know, we're so excited about this. This is really going to be awesome. And I'm a huge podcast listener myself, and one of my biggest pet peeves is when you have these really superficial podcasts. They're like, you're like, you know, five things you should be investing in right now. You know, and you're listening to the thing, and you're like, and you get to the end of the
want
episode,
this to be real,
and you have no idea what they talked about.
Yep, 100%.
And here, like, you know, there's probably moments that Callie talks way over everyone's head, and I'll try to rein her back in.
You do a good job doing that in general.
So, but we're gonna make this awesome for everybody, and really, like, and also, like, we're gonna have fun with this, because this has to be fun.
This is
for
so
us.
cool.
This is so cool.
If nobody else listens to it, when our kids are, you know, when we're grandparents, we can go, oh, remember back time when we talked to everybody.
So next time, I think we're going to be talking about sleep disorder breathing. What is that? Callie's going to go into it. I had no idea what sleep disorder breathing was. I thought it was just, I didn't know it was a diagnosis, first of all. And second of all, I didn't know there was, you know, a tooth-borne treatment for it. And so we're going to talk about that.
I can't wait. It's going to be great.
All right.
Thanks, guys.
Bye.